Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Anatomy is the study of the structure and function of the human body. Oh, well, I remember. Days or months or 2 semesters, I think we had of anatomy. But it is truly one of the most important courses in the education of doctors and physical therapists and a lot of other healthcare professionals. You just have to get used to the smell of formaldehyde.
Oh, Tom. Body donation plays a critical role in helping medical and health-related science students to master the complex anatomy of the human body and provides researchers with an essential tool for discovery to help patients.
Well, where do the bodies come from? Did you ever
I don't really
ask
like
that
to
question?
think about it,
Yeah,
but I'm
well,
glad we will.
Here to discuss body donation is the coordinator of the Bequest program at Mayo Clinic, Mr. Sean Heath. Welcome to the program, Sean.
Thank
Good
you.
to have you.
Thank you. Yes, thank you for having me here, Tracy and Dr. Shives. I appreciate the opportunity.
It is kind of a strange job that you have, or not. Do you think there's nothing strange about it at all?
Well, there are some aspects of it that are a little unique, and there's not very many opportunities to have this ability to provide this type of opportunity to the medical community.
Now, this radio program is heard on 90-plus stations across the country, and so it's a little bit unique to the Rochester, Minnesota area that there are probably more people, percentage-wise, who consider donating their body to science. Is that fair to say?
Absolutely. And I think it's fair to say, too, that because of the scope of Mayo Clinic and the patients that travel here from all over the country, that we have a great deal of interest across the U.S. in body donation. And because of that, we do, unlike many other programs throughout the United States, do accept donors who want to bequest their body from all across the U.S. And so it just allows us to be able to fulfill the wish and scope of what Mayo seeks to do in terms of reaching the community outside of the Rochester area.
Don't you find it sort of interesting that there are as many people as there are who want to do this?
Absolutely. And there's several reasons for that. And one of them, and the most important, is because they have been affected by Mayo Clinic in terms of either themselves, the health care that they've received, or a family member. And it's the compassion and the impression that they get when they meet all of the employees here at the clinic that strikes them. And for many of them, that's what motivates them to want to donate their body to Mayo Clinic.
And I don't even know exactly how the process works. I mean, if a patient of mine said, I want to give my body, donate my body to Mayo when I'm gone, how do you do that? What do we contact you?
Sure. And so that's a good question, because there are many folks who put this in their advance directive or their healthcare directive.
Oh, okay.
And they make the notation that they want to donate their bodies to science. We do have a specific consent form for our program at Mayo Clinic. And it's important to know that there are some aspects about what we do in terms of body donation here that may make the decision for some whether they want to do this or not. When you say donation, it can mean so many different things. Mm-hmm. And we just want to be clear of what we do and what our limitations are so that the family and the individual who's doing this is comfortable with that.
What actually happens to the body? When a person dies,
Mm-hmm.
If it doesn't go, I don't know what you want to say, the traditional route, but what happens to the body, and then how long is it used?
Sure. Well, our length of study can be anywhere from 6 to 15 months. And that is completely dependent on the curriculum that we have going on and also the medical conditions of the person who passes away. And so often what we do, the vast majority of what we do in our area is procedural skills training. And that entails anything from teaching orthopedic residents how to do knee arthroscopies or other joint replacements to teaching internal medicine residents how to do thoracentesis or paracentesis. And so
those are operations on the heart and the lung.
Correct.
Get the fluid out from around the lung. Yeah.
Right, and those
procedures.
And those are just two examples. We serve almost every specialty throughout the clinic in terms of training, product development, educational purposes, those sorts of things. And so that's a vast majority of what we do. Although we do the gross anatomy, the more foundational aspects of learning how the body works and functions, but I would say 85% of what we do is more catered to the direct patient benefit in terms of the day-to-day aspects of what the staff and the residents and clinicians do that will help better prepare them for patient care.
So does the student just use a body during that course of time, whatever many months you just listed, whatever it ends up being? Then what happens to the body?
At the end of our educational studies, we do offer a form of cremation right within our facility here on the clinic campus. And if the family so chooses, we can provide that service of cremation and then return the cremated remains either to the family, or we do have cemetery property here at Oakwood Cemetery in Rochester.
I think it's interesting, isn't it, that the medical students don't do the dissection of the entire cadaver like we did when I went to medical school, right?
Well, some do. And so the different curriculums that we have, the medical school does use the entire body. They go through all the organ systems, the upper limb, the lower limb. They're trying to learn everything. The other curriculum that we have, the physical therapy, obviously they're more focused on the musculoskeletal system.
The extremities, huh?
Correct.
And the back.
Correct. Yeah. And learning the muscles and the ligaments and joints and things that they'll need to do when they see patients. And so in terms of the resident training, the more procedural skills type of events that we do, that's more specialized. And so we're able to have more of those departments involved in the body because they're more focused on one area or the other in terms of their curriculum or what they're hoping to study.
Yeah, it's incredibly beneficial, incredibly helpful to medical students, to physical therapists, and as you mentioned, to learning how to do certain procedures, to actually do it. That there is no model that's as good as the human body.
That's correct. And there have been studies here through different simulations and trainers that there really is no way to replicate that experience without the use of people who donate their bodies.
Dr. Shives, did you know the name of the person that was your body that you used in your medical school?
No.
Did they tell you that?
No, we never. We had names for them. We named them, but it was always very respectful. I think all the medical students are very respectful of the bodies that are donated because you realize how important it is to your education. But I don't think, and that's still true today. We wouldn't know the name of the donor, would we?
We do disclose the first name of the donor, along with their age and their occupation. And that helps the students make that connection with their donor. Because as they're going through their curriculum, they're wondering, who is this person? What did they do? Obviously, they have family. They have brothers and sisters and a spouse. And so as they think about that and they think about their own mortality, in addition to what they're trying to learn, it helps make that connection because it is their first patient.
So how many bodies in your lab right now?
Well, and that varies from time to time, but in the course of a year, last year we had 217 donors. And they're all in various states of how they're used because of the different curriculum that goes on. So,
do you have more donors than you need?
Well, currently, no, we are still in need, but we are registering approximately 700 consents annually. And so our need, which is about 217 to 219 per year, down the line, if that number of donors that registered passed away in the course of a year, we may not have that opportunity to use all of those bequests in that period of time.
Let's go back to our 94 radio stations, and someone in Maine wants to give their body to the Mayo Clinic in Rochester, Minnesota. Is that even possible?
Absolutely. It certainly is. There's a few things to know about that. The first and most important thing is to make sure that that consent is in place. Second is to inform your family of what your wishes are, because if they don't know what you want to do, it won't happen. And if you do want to do that, the thing that will need to happen is a relationship with a local funeral home, and they will be critical in terms of helping to coordinate the transportation to Minnesota. And there also is some cost, and generally the further that you get away, there's going to be some cost to your family, but there's no distance that's too far away to not make this happen.
All right, Mr. Sean Heath, coordinator of the Bequest program at Mayo Clinic. Thanks so much for being with us. We learned a lot.
Oh, wonderful. Thanks for having me.